Normal spinopelvic motion from standing to sitting demands natural rollback of the pelvis, which is accompanied by posterior tilt of the pelvis that allows the acetabulum to open for clearance of the hip, posterior sacral tilt, and decreased lumbar lordosis, which serves to make room to femoral head during normal femoral flexion anteriorly, thus preventing impingement and dislocation. How to measure with the app. The app offers a very convenient way to determine the most accurate lines in order to measure the angles. Once you load or capture the patient's image, by default the button STD is highlighted, meaning that you have to input preferably the standing X-ray to measure. With the transparent circular template, you aim to locate the posterior corner on the top margin of S1 of the sacrum, and by clicking the button point the P1 point is marked. Then by clicking the point button at the anterior corner of the superior end plate of S1 vertebra, the point P2 is marked. Next you aim at center of the femoral heads, and by clicking the point button you mark the center of femoral head. C3. Pelvic incidence angle, pi, sacral tilt angle, straight, are calculated. Next you aim at the most anterior point of the acetabulum, and by pressing the point button, the A4 point is marked by the same way at the most posterior point of the acetabulum wall. Thus the A5 point is marked. The angle subtended by A4-A5 line to the horizontal reference line is the anti-inclination AI angle, which is measured. By pressing the button point you mark the F6 point by aiming at the most anterior surface of femoral shaft. The pelvic femoral angle, PFA, is calculated. The sacroacetabular angle, SSA, between a line from anterior to posterior wall and sacral slope is also calculated. The results are compared and categorized as normal or abnormal, and also the range of normal values are printed on the screen. An asterisk appeared above of button STD, meaning that the measured data are stored in RAM and not discarded. By importing the new sitting X-ray, the data from previous measurement, namely of standing X-ray, are not lost. Once you press the STT button, which is highlighted, you can measure by selecting points in exact the same way. The same points as mentioned above for the standing X-ray. The results of sitting X-ray are printed also on the screen and compared. Finishing the measurements, the asterisk appears above button STT, meaning that the measured data are stored in RAM. The app calculates and compares with normal reference values, and a screen message appears. The detailed analysis of data by comparing the standing and sitting position is exported with the Save button. The TXT file can be opened with notepad or numbers externally. Please see tutorial videos at the developer's website. The software is a Class II medical device in the FDA. All information received from the software output must be clinically reviewed regarding its plausibility before patient treatment. Spinopelvic Mobility App, indicated for assisting healthcare professionals. Clinical judgment and experience are required to properly use the software. The software is not for primary image interpretation. Example case: late dislocation incidence in total hip joint arthroplasty patient after measurement in standing and sitting. Note: lumbar sacral fusion. The acetabulum cannot antevert and thus impingement and dislocation. If dislocation does not occur, the femur must undergo additional flexion in order to accommodate the lack of sacral motion to reach a 90 sitting position.